All right, we are live for another episode today. Thanks so much for jumping in with me. My name's Gary Bird, and this is the Dental Marketing Go podcast. And we go over actionable items that actually help your practice grow. And today we're going to be going over the 10 dental growth commandments. Now, I don't know if I'm going to be able to get through all these today. I'll get through a couple of them, but I want to give you actionable items that you have to do if you want to grow. These are non-negotiable. It's impossible to grow without these things. I've looked at thousands of dental practices. I work with hundreds of groups, and I've seen over and over and over again that if you don't have these things, you will not grow. So this is a very important show if you've struggled with growth. If you've been stuck without growth for a long time at your practice, I'm going to share with the reason why is probably one of these things, okay? Not only that, I'm also going to give you free resources for each of these. Each of these have a training around them because we already know this is what our clients are going to face. We've already built the training around this, okay? So let's jump into it. Commandment number 1. Thou shalt not miss 30% of your calls during business hours. This is a big problem. Now, a lot of people just say that it's not a problem. And they say, no, that's not my office. We don't miss calls. Yes, you do. If you do not track it, if you're not watching it, you need to actually look at how many unique people, new people that are not in your PMS, okay, are calling your office every single day and you're not picking up the phone. And I'm not talking about after hours. I'm not talking about when you're not in the office. I'm talking about while you're in the office. Industry average floats between 30 and 35%. You have to be able to answer your phone. This is not negotiable. You will not grow. You can't lose 30% of your marketing budget and expect to grow. That's how it works. If you're spending $10,000 on marketing and you miss 30% of your calls, that means you lost $3,000. It doesn't work. There's no marketing that's going to work if you're doing that. And we use Trackable. We can actually see when a new person calls. If it's the first time they've ever called your office, we can see in the PMS that they're brand new. That's a missed call. That's a missed opportunity. Okay, and I get it. There's spam calls, robot calls, all those kind of things happen too. But you can see the normal numbers from your zip code or from your area that are like regular numbers of people calling and they're missing these calls. You have to answer the phone. Now, the reason that you're missing phone calls is not because your team is bad. It's because you haven't done a good job as a leader, making sure that they're fully equipped and that there's coverage at the front desk, especially at peak times. That's on you. That's not on them. If there's one person answering the phone, they're going to miss calls. That's just the way that it works. So you have to be able to equip your team to be able to answer calls, and they can't be rude when they answer the calls. Now, I also blame that on leadership as well. And the reason why is because they're busy. Most offices are really busy, especially at the front desk. They're short staffed. They don't have all the time in the world. They're checking people in, checking people out, doing billing. You're asking them for things. The phone's ringing. There's emails. There's text messages, et cetera, et cetera, et cetera, et cetera. And you have to be able to stop everything when the phone rings, answer it, and do it with a smile on your face. That's just the way the customer service works. And that's probably not going to change for some time. There are some AI things out there, but a lot of them are not where they need to be to convert at the level that you want. To be honest with you, most of the AI things out there are far worse at conversion than your front desk. Far, far worse, okay? In which I'm going to talk about in a second. So I have a 5-star greeting. You can scan the QR code right there. If you're listening online, you can go. There should be a link included with a little landing page that will have the 5-star greeting. Make sure that your team is always using this 5-star greeting, okay? Always using it. And what it does is it makes sure that you answer the phone correctly, happily, and with a smile on your face.
Sorry for interrupting the show, but I got something special for you. So we only got 27 more seats at our in-person event. We're going to be helping you grow in 2026. We're going to be putting together a growth map for you, helping you with attracting the right kind of team members, attracting the right kind of patients, and getting your systems in place for next year so you can actually grow. Now, this event is normally $499, but I have a discount code down below for $199. Make sure you sign up right away. There's only a few seats left. We look forward to seeing you soon. Now back to the show.
All right, next. Thou shalt not allow the front desk team to go untrained. this kind of ties into the front one. Now, they got to answer the phone, but when they do answer the phone, they have to be able to convert. The average conversion of a front desk person for new patients that are coming from marketing is 50%. And I know what you're thinking. No, Gary, that's not my team. We are amazing on the phone. We get all the patients that we want. Okay, do you track it? If the answer is no, you are close to 50%. There's really no arguing this. There's really no debating this. I don't care what you've heard a couple times with your front desk answering the phone. That is not data. You're a dentist. Come on. You know that's not data. That's your ear. Your ear is not data. You need actual data to be able to look at and see how your front desk is doing. This is so important. Now, to get them up into the 80% conversion on your marketing patients, you have to train them, and then you have to hold them accountable. So I have a QR code with the training that we use that will absolutely get your team up to par, okay? You have to have this locked in. There is no negotiating this. If you miss 30% of your calls and then you only convert 50% of the ones that you answer, you just lost 75 to 80% of your marketing opportunities, which means if you're spending $10,000, you've just lost $8,000 and you haven't even got anybody in the chair yet. And then you go, marketing stinks. Well, these growth commandments don't care about what you think about marketing, don't care what you say, doesn't care what you feel. This is why the majority of dentists are stuck. These first two slides is why the majority of dentists feel frustrated, stuck. They can't get their practice to grow. So those are the first two things. Number one, got to answer the phone, and you got to smile when you do it. Number two, your team needs to be trained, and you got to hold them accountable to that training. It's not that you don't have the information. It's that you're not executing on the information, or you're making excuses. Okay, that's what it boils down to. All right, commandment number 3. Everybody's smiling. Okay, good. Here we go. Thou shalt not schedule new patients 2 weeks out. I was just looking at an office, and they want to get to 100 new patients. And guess what? They totally can do it. They're getting about 40 new patients, from 40 to 50 from patient referrals. And we got them over 100 qualified patient leads in a very competitive market. They have more than enough opportunity, but guess what? They have a 50% no-show rate. Oh no, they're bad patients. No, we went in and looked at it. Guess how far they're scheduling out? 22 days on average. Guess what happens when you schedule out over 14 days, over 20 days, a month out? People no-show. No one wants to wait a month to come into the dentist when they need stuff done. Listen, the honest truth is no one wants to go to the dentist to begin with. No one wants to go to the dentist. And then when they do need a dentist, they don't want to wait 3 weeks, 4 weeks to take care of it. So we have to be able to schedule effectively. Most of this is just a system issue. I get it. There's some capacity issues here and there, but you can overcome that with block scheduling. And I have a whole training on that. So there's a QR code right there. You can scan that. I'm going to drop the link to the landing page with all the different resources. You're going to be able to access all of these. And each of these is, you have to have all these in place. Okay? If you answer all of your phone calls 100% and you convert at 100%, but then you get a 50% no-show rate because your scheduling isn't right, you're not set up for success. You will fail. Your marketing will not work. It won't. It doesn't matter how good the marketing is. It could be perfect marketing. It's not going to work because you're not following the growth commandments. You have to follow the growth commandments. There are no way around it. It's not subjective. It's objective. This is not an option. This isn't up for debate. It's not something that we can sit here and say, well, maybe there's another way to do it. There isn't. There isn't another way to do it. If you don't answer the phone, you won't grow. If you don't convert on the phone, you won't grow. If you schedule people a month out, 2 weeks out, you're not going to grow. You're just not going to grow. All right, number next. Thou shalt not avoid using patient financing. Okay, so now we got the patient in the chair, but nobody's buying treatment, or very few people are buying treatment. Why is that? Well, they don't know you. They don't trust you yet. And to gain trust, you must use patient financing to get the treatment that they need done. They need a boatload of work done. They don't have, most people in America do not have $10,000, $20,000 just sitting around to invest in fixing their mouth. They don't, but they need it. And you did a good job educating them on the need. However, you did not give them the tools to be able to take care of it. And listen, there's a huge difference between setting and saving. Setting is this: hey, Mr. Patient, you got $10,000 worth of work that needs to get done. You really need to get this done. This is really important. Here's what's going to happen if you don't get this done. These fillings are going to turn into root canals or implants, et cetera, et cetera. Right now, each of these teeth are, it's a $300 problem, a $500 problem, a $700 problem, but they'll quickly turn into $3,000 to $10,000 problems each. And then you're going to be out here getting, having to do all kinds of oral surgery and things like that. And it's not fun. It's not a fun process. So we want to avoid that. So you can pay in cash in full for all of that, or we have a monthly payment plan that you can do through this financing company that costs X amount of dollars a month. Which option works better for you? And by doing that, the patient feels like they have options. They don't have to say, oh, I can't afford it. No one is going to tell you, no, I can't afford it. They're just going to leave and never come back. And this is why you lose so much treatment. Now, I know what you're thinking. Well, I have to pay a fee on that. Well, paying a fee on some treatment is better than not getting the treatment. It's very simple business, very, very straightforward business. And so you want to have options there. Now, here's what most dentists do. Oh, no, Gary, I already have patient financing. Yeah, but you don't use it. And if you do use it, you don't use it properly. Here's how you train your team to do it. You say, hey, present the $10,000 treatment. Here's the $10,000 of work that you need done. And they go, okay, let me think about it. Oh, we got patient financing if you want it. Well, guess what? That feels slimy. That feels like you were hiding something. Why wait till they're walking out the door to offer patient financing? Why not offer it up front? And no, I know dentists hate the used cars salesman sales tactics, those kind of things. To be honest with you, using that kind of tactic where you're trying to save, 3% or 10% or whatever the fee is for the finance company, and so you're offering it to them afterwards, even though you know that they probably need it and want it, is not a good feeling. And this is why a lot of people don't end up doing the treatment that they need. Okay? All right. Number next. Thou shalt love asking for Google reviews. This is one of the most powerful things that you can do for your practice. This is one of the most powerful things you can do for your practice. People say, what's the number one thing you can do for marketing? It's not running ads, it's not SEO, it's not your website, it's not anything like that. By a lot, the number one thing that you can do for your business is get the most Google reviews in your market. And it's not just your star rating, right? I've had people say, well, I got a 4.8 star rating. They have a 4.7. That's the same. Same thing. Okay, it's not same. What's powerful is you have 1,000 Google reviews and your competitors all have 300. That speaks volumes. You want to be the number one rated dentist on Google. You should be attacking Google reviews. This helps it helps your site rank better, helps with SEO. It helps all marketing convert better. I don't care if you're doing postcards, billboards, digital, it doesn't matter what you're doing. Everybody ends back at your Google reviews and looking at those. That is one of the most powerful things you can do to get all your conversion of all your marketing, all your ROI of all your marketing, Google reviews, it all goes up. All of it. It helps you get better teammates, better team members. Guess what an A player is going to do before they come to your office because they have choices. The dental assistant or the hygienist that you really want and they're amazing. They got 3 or 4 options. They're looking at 3 or 4 options going, what office do I want to look at? Guess there's going to get the first nod? The one with the most Google reviews that's kicking everybody's butt. When you go to hire an associate, guess what they're going to do? They're going to go look at your website and then they're going to go look at your Google reviews. And if you have the most Google reviews, you can tell them like, hey, we got a lot of Google reviews. What else? You can, when you sell your practice, would you rather buy a practice with 100 Google reviews or 10,000 Google reviews? Which one's more valuable, right? So it's just like, it helps every part of your business. So we have a resource there for that as well. And then on the patient financing, we actually have a treatment coordinator training that you can use across the board, and that will really help your team grow. So you just scan that and you can access that. So let me know if you have any questions down in the comments below. Hopefully this was helpful to you. I hope you have a good day.